Hello, everyone. Welcome to another episode of the Poultry Nutrition Blackbelt Podcast, where we discuss some of the latest in poultry nutrition and nutrition-related research and industry trends in approximately 10 minutes or less. My name is Sam Rochel. I'm an associate professor of poultry nutrition at Auburn University and one of the co-hosts of the Poultry Nutrition Blackbelt Podcast. And today I'm joined by Dr. Dan Wilson. Dr. Wilson is a veterinarian who received his degrees from Purdue University and worked in the commercial layer industry for several years before starting his own veterinary consulting firm. And so look forward to talking to you, Dr. Dan. How are you doing today?
I'm good.
So I think, you have a wide background in a lot of different health-related aspects of the poultry industry. And so I think what we're going to kind of focus on today, since we have a short amount of time, potentially talk about E. coli in laying hens. So as I mentioned, I don't know very much. I'm not a microbiologist. I'm not a veterinarian. So, I'll do my best to kind of keep up here and keep the conversation going, and excited to learn from you on this today. E. coli in laying hens, what are, again, as a nutritionist, give me the quick and dirty kind of what someone new to this field should know.
Yeah, so most of what I would talk about would be definitely in a U.S. context, because we work with U.S. layers, and mostly more so in the Midwest. We have a little spread out outside of the Midwest, but, layers in the past, peritonitis and or other E. coli related causes of mortality were always kind of a top 5 list for layer vets way back through the past several decades, even in conventional egg production in cages and those sort of styles. But certainly kind of when I graduated, which was 2012, I kind of started right at the beginning of all these transitions to alternative housing and aviaries and cage-free and even outdoor access. So in layers, it was already a top 5 concern.
Elevate bird well-being and improve profitability with Cargill's tailored nutrient solutions that deliver performance. Cargill is leading through applied nutrition, leveraging deep nutrient insights and understanding of the animal's nutrient requirements to achieve your production and performance goals.
Certainly, like I said, that the fecal oral access, being able to move about in the litter and or dust bathe in those same substrates definitely creates a little more exposure than in a cage system. I mean, that's an easy one for anybody to understand. But the other big part of alternative housing is that we see a lot of other primary diseases. E. coli loves to play second fiddle to many other things. And so alternative housing has allowed us a lot of more of those primary pathogens to be a challenge as well. So in addition to just the housing itself, the compounding factors of mycoplasmas or coryza, cholera, those things in combination with E. coli, other viruses like bronchitis virus, those things really give it a little shove to be a little more of a problem too. So, I mean, most of the E. coli is going to be secondary. If they've gotten to the point they're affected by it, it's probably ultimately a cause of death. And so most people would find that either, posting session with a vet, submitting birds to a lab, or if they're comfortable opening birds, the classic bacterial air sac or peritonitis, dicaceous material and those sort of things. So we're always working with nutrition teams and all of the natural products that exist, to trend that flora to the good side. And that's always a preferred way to do it, is just get rid of the bad ones. But as the vets, we always like to try to prevent those primary things. So figuring out those other primary disease causes, and whether it be like serology for a bronchitis program or typing of the bronchitis that's present, and fixing those things from the base program. Those are really the function we play as vets, is trying to get rid of the primary diseases that let E. coli in the door.
Gotcha. Yeah. Obviously I'm always coming at this from a feed formulation standpoint. Are there particular ingredients, not necessarily additives, but some of the primary ingredients that bring more issues or maybe help more than others?
Ask your nutritionist.
Gotcha.
No, I don't think so. I mean, layers were at the mercy of being on a mash feed. So, yeah, I mean, the sanitation of the feed and quality is definitely important, but most of what we see ends up probably being more of a respiratory route of infection. And so we want the gut health to be good, but, we try to focus on the respiratory aspects of it more so as the vets, I guess.
Yeah. That makes sense. Okay. Are there any other management factors that you can think that help? I mean, particularly with the respiratory side, I mean, is there, and I know in maybe systems that aren't very well controlled, you're kind of at the mercy of the nature of that. But I mean, is there anything in more controlled environments that you can do from a management standpoint to help?
Definitely the U.S. has, a more or less long-term experience with housing design and ventilation. Mm-hmm. And so that's been trial and error in some aspects of what systems work better, what systems have less dust generated, and opportunity for those exposures. So hopefully now that we're several years into these conversions, some of those lessons learned start impacting, improving the ventilation and lessening the standing, manure and dust that generates from depth, a certain manure depth and those sort of things. So we definitely see those better designs help limit some of the impact of E. coli for sure.
Gotcha. Yeah. So the housing management and design is very important from the get-go.
Unfortunately, those are hard to fix after you've built a multi-million-dollar house.
Sure. Yeah. Yeah.
Hopefully we figured those out quickly.
Yeah.
And there's some really good designs now that have helped that a lot.
Yeah. Very good. Now, I know that's been a very rapidly evolving area and a lot of transition over the last decade to these different systems. And as you mentioned, a lot of lessons learned. So we definitely appreciate your efforts in that and helping people make better decisions moving forward. So as we wrap up here, are there any other major aspects of E. coli and layers that you would like the people to keep on their mind? And
I probably say this on every presentation or podcast I've ever done, but got to have good diagnostics. I know there's those decades of experience saying every bird with peritonitis is E. coli, but we have a lot of new players in these alternative systems, and good diagnostics to rule out the other primary players are really important too. So the days of saying everything was E. coli with your eyeballs only is slowly or quickly fading away, because some of these things can look identical, can even present textbook identical, but the diagnostics and the lab work really show otherwise. So trying to flip that narrative on, egg production in the U.S. that you can just diagnose things with a quick opening of birds. You really got to include some diagnostics sometimes to map that out.
Yeah. Awesome. No, that makes perfect sense. More information is always helpful and can be confirmatory or maybe make you think a little bit differently about things. So that's a great message to spread for sure.
Sure.
Ready for more sustainable poultry production? New data suggests that decreasing bacterial loads in feed using Termin 8 supports enteric health, leading to improved performance. Gut health is more than a gut instinct. Learn more today at annietalks.com or visit us at IPPE booth 6033.
Awesome. Well, thanks, Dr. Dan. We appreciate it. I think we've learned a lot. And this, again, especially for people like myself who have very little experience in dealing with E. coli, this was interesting to learn some of the key aspects on causative factors, predisposing factors, and kind of what you're managing out there day to day. So really appreciate it.
Thanks for having me. I look forward to the days of talking about E. coli instead of avian influenza. So hopefully that's any day now.
Right. Well, good luck with that and the rest of the winter on all the challenges that it will present. So thanks again, and we really appreciate it. And we'll catch all of you on the next episode. If you ever have any feedback on this topic or other topics or potential guests, we always appreciate those recommendations. Until next time, we'll talk with you then. Bye-bye.
Hey everyone, we're always searching for the latest and greatest research to share each week. And if you have a poultry nutrition related research trial and would like to come on the show and talk about it and share it with us, feel free to email the research link, the paper where we can find it, or the abstract to hello@wisenetics.com. That's hello@wisenetics.com, and I look forward to hearing from you.